Welcome, McCall, to the podcast.
I am so excited to be here. I just love what you guys do. So thanks for having me.
Yay, return guest, because we're going to talk about this topic in the first episode that you were on, but we decided that it could be a completely separate topic. And I'm glad that we're giving it its own space because this is a very controversial topic. So I want the listener to feel really educated from all the different angles of this topic.
Yeah.
So let's start by, what are GLP1s, like Ozempic, Wegovy, what are the Mounjaro? What are these drugs and what is the mechanism of action? Like, how do they actually work in our bodies?
Yeah. So they have been around a really long time. We've had these drugs about 20 years. They influence our physiology, honestly, in a lot of ways. We're still finding out new ways all the time. But originally, when they were invented for the treatment of diabetes, and then later now being used for weight loss a couple decades later, they influence your blood sugar. They increase your insulin to remove excess blood sugar from circulating in our system. And so what that does is it reduces our tendency to store fat. Slowly over time, it sort of recalibrates our blood sugar metabolism. It ultimately allows insulin to become more sensitive because the demand for overexpression of insulin can reduce over time. That in turn also reduces our blood sugar. So that is this basic mechanism of action, but it does so much more than that. So we have GLP receptors all over our body, our brains, our physiology. They regulate everything, from inflammation in several different pathways to suppressing that inflammatory response, to making it all the way to our brain and influencing our neurochemistry. It's pretty fascinating. Like, we think about them in simplistic terms. They really aren't so simple.
Yeah. Can you talk more about how it influences the brain chemistry? Because, I have people that I know that have taken it and they say, like, I just don't have much of an interest in food.
Right.
So what's that about?
Yeah. So it attaches to receptors that influence cravings, influence our desire for things from food, but also like addictive tendencies like alcohol, smoking, gambling, disordered eating patterns that we're kind of obsessively thinking about. It binds to those receptors and makes us feel like we're not needing to seek out this pleasurable thing, whether that's food or whether it's smoking or gambling or whatever it is. And it hits on that receptor in a way that makes us feel satiated without engaging in those often destructive behaviors for our health.
Wow. That's really interesting because it could have an effect on like alcoholism, gambling, addictions.
It is for people who are our patients at Modern Thyroid Clinic, and soon our sister company as well, Modern Weight Loss. They naturally reduce their drinking by probably 70 to 95% without effort. Like, it is very passive, which, right? Like, if we can passively reduce people's desire to drink wine 4 to 7 nights a week, even if it's just a glass or two, that has huge benefits for our long-term health. Yeah. And without struggling, people just naturally do it.
Yeah. Does it also reduce desire in general? So like, what if we desire like things that are healthy for us, or even like desiring a partner, like libido, things like that? Does it also influence that sort of desire, or does it tend to be more of the like over desire that causes these more destructive behaviors? What have you found?
I would say the negative aspect, especially with standard dosing, right? Like, all these people are being put on these doses of these medications that were made for diabetes. Well, a lot of people don't need diabetic doses of these medications. So we're getting sometimes the response of, I don't want to eat food, which is very destructive for our health, right? Yeah. And that is never okay. So I would say in an extreme that can happen. It's interesting. So like, you would think, and initially people were saying, gosh, we're finding apathy, this sort of depression, this flat mood. There was a brief stint of where people were concerned about suicidal ideation. So there is that side of the conversation that you kind of want to be attuned to when you're treating people with this or interacting with them. But it also improves like depression and anxiety in other studies, especially anxiety, which often can be inflammatory. Depression too can be an inflammatory condition that is either neuroinflammation, it's inflammation tied to the gut. And because of the potent propensity of these meds to lower inflammation, it can influence that in a positive way. It's very common for me to see people's mood improve. So I have a couple patients who've even come on my podcast, which you'll be a guest on too, and talk about their improvement in depression and anxiety.
Wow.
Yeah.
So is there a case for like microdosing this, or because you said like maybe these big doses that are given to people with diabetes aren't needed for other populations?
Amen. So
Okay.
I honestly believe the future of these meds will not be in the standardized dosing that we're doing now. I think that is the complete driving factor in muscle wasting, in, collagen loss, in all of these issues, in nausea, vomiting, hair loss. It's because people are over-medicated, basically almost everyone. And so I think certainly the way that we approach it in our programs is 100% microdosing. We might escalate the dose to reach standardized dosing. We never start there. We never increase in those same mechanisms because you'll bomb out people's appetite. And nothing good ever comes from not eating enough food.
Right. Well, that's what I was going to ask you next. When you are prescribing this, how do you educate your patients on nutrition and exercise? Because I know one of the criticisms of this medicine is that you lose muscle probably just from not eating enough. Yeah. So how do you educate your patients to eat and move and exercise?
Yeah. And it's so important to speak to the muscle loss piece because I'm in functional medicine. I'm in the world of like progressive medicine. And so many people in this world in my circles are demonizing these medications because of that. And I'll tell you, the recipe for muscle loss is not eating, not moving your body, not eating protein, right? Yeah. Doesn't matter. On a GLP-1, on a weight loss med, on Mounjaro or not, you're going to lose muscle. So the way to combat that is to never take a dose that doesn't allow you to eat adequate protein, right? If you are not wanting to eat enough food and you're not eating enough food and you're not moving your body because you're too tired, you're too nauseous, whatever it is, you'll lose muscle. So one, we tailor dosing. I advocate so strongly that this is not a one-size-fits-all system, just like most of medicine and other aspects. This should be tailored per person, per patient, uniquely. And because no matter what you preach for lifestyle, if you're over-medicating these people, they're not going to get enough food, enough protein, enough calories. Second to that, we talk a lot about, I describe it as ordering your food. And I don't mean like takeout, but starting your meal with protein. Like make sure you get enough protein, certainly before you fill up your body with carbs, or nutrient depleted food. So we start every meal with protein, then we move on to micronutrients, like nutrient dense foods. And then if you have extra room, eat some carbs, enjoy the things that are less nutrient dense. And then from the exercise piece, we kind of emphasize the same thing that you do. We want people lifting weights.
Yeah.
I highly discourage people from doing cardio while they are on a GLP, actively trying to lose weight. It's just creates too much stress on the body. It depletes them more. We want them building their resilience, building their muscle, fueling their body. And then two, my goal with people long-term is to get them off of these meds in 95% of cases. So when they exit the program with an increased muscle mass, guess what? Their long-term sustainability of their weight, their metabolic improvement is so much better.
Yeah. Well, my husband and I were just talking about this, kind of the upward spiral or downward spiral that you can get in from a metabolic standpoint. So if your metabolic health is good and you have a good baseline muscle mass and you have all these good habits surrounding those things, it's like an upward spiral. You have better energy. You have more stabilized hunger hormones. You sleep better. You feel better rested. It's like you're upward spiraling. And then I think the opposite can happen a lot of times where you are losing your muscle mass. You're getting more sedentary. sedentary, because you're tired, because your metabolic health is worse. And so you're downward spiraling. It creates more friction when you're trying to create those healthy habits. So I think, do you kind of see this as something where someone feels almost like stuck, like they're trying all the things?
Yes.
They're tired. They can't get themselves to like exercise. They can't seem to like lose weight. They're doing all the things. Do you feel like this is one of those just kind of like catalysts that gets them going in the right direction? Or how do you view that?
Such a good question. So I think the best suited people for these medications are people that already have their habits in order. They're already people who exercise. They generally eat well, but they can't influence their weight. Like, it doesn't matter what they do. Metabolically, there's been so much damage. They can't reverse that. They can't lifestyle their way out of their weight issue, their hemoglobin A1C, their blood sugar elevations, their cholesterol. They're doing all the things and it's not working. So I view this as a catalyst, but also a way to heal that loss of metabolic potency, to rehabilitate your metabolism so that long-term you come off and then you sustain it. Then you're able to appropriately exercise and influence your weight, to eat well, influence your weight, because, and the people definitely that suffer with this issue are my people. They're thyroid people, right? My practice is filled with women who eat paleo, who exercise 4 to 7 days a week, who lift weights, who walk, who do literally all the things they're supposed to do, but they can't lose 5 pounds if their life depended on it. And these meds can powerfully rehabilitate that, where they can do all the right things and actually influence their weight, their health, their long-term health outcomes.
You said the goal is to get these people off the medication. So when you do get them off the medication, do you find that they're able to sustain these lifestyle changes and the weight loss that they've seen, the muscle growth that they've seen when they were on the medication? Or do you feel like there's kind of like a yo-yo period where they might gain some weight back? Like, what have you found when you get people off?
So I am such a data collector. Like, I've been doing this now for 3 years, intensively collecting so much data, measuring outcomes, recalibrating our program, shifting things until we hit sort of a success point. And I feel like we've gotten there. So when people come off of the program, we encourage them to do that when we show on labs metabolic sensitivity. Okay. And I don't release that data yet because it's ours still. But we have very specific measurements that we're looking for that show, hey, the person that couldn't maintain their weight without over, exercising and under eating now is able to successfully maintain their weight with normal habits. And they do really well. Now, if people come off early, let's say they hit their goal weight, and they're like, I don't want to spend money on this anymore. Like, I don't want to do it. I'm over it. I don't want to deal with the injections. But their numbers are not optimal in terms of their labs. They don't show metabolic resensitization. Those people will gain weight back.
Okay. So you kind of wait until you see things from their blood work that you're like, okay, this means you're on a good path. We can slowly start to titrate you off of this.
Yeah. And there's a subset of people that want to stay on these meds for different reasons that I'm sure we'll dig into, from a longevity perspective, from an inflammatory perspective, from long-term benefits of these meds. And those people take a different approach, even after they've hit their goal weight, even after they've hit their metabolic numbers, and often continue to microdose. But the vast majority of people in our program come off successfully.
What are the side effects and risks? And I want you to talk both short-term and long-term.
Yeah. So it's interesting. I mean, I've never in my medical career seen a medication so demonized, or a class of medication so demonized for, quote, side effects, when the side effect profile is shorter with these medications than probably any medication I've ever seen. And all we are talking about is these side effects. Okay. So to start, generally the short-term side effects of nausea, of muscle loss, of hair loss, of collagen loss, these are dose dependent. Okay. These are not side effects of this medication irrespective of dose. It's people who are over medicated. In our program, I think we've sent in maybe 2 Zofran prescriptions in the last year. like people don't get nauseous. Nausea is not an issue because, again, we tailor dosing for people. We don't try to shove them into this one size fits all box. And we don't have people losing muscle. We don't have people losing collagen. Why? Because we're making sure they're never on a dose so high they're not eating enough food and micronutrients. So those are sort of the short-term ones. Also, you can have gallbladder issues, right? A lot of people talk about these meds and gallbladder risk and pancreatitis risk. Well, the deal is if you lose weight, doesn't matter how you lose weight, you're at risk for gallbladder issues, especially if you're a woman. If you have gallbladder issues and you lose weight, you're at risk for pancreatitis. So it's not the medication itself that creates gallbladder issues, pancreatitis issues. It's actually the weight loss. So you can pick your way that you want to lose weight. Your risk for pancreatitis and gallbladder issues persists if you're on a GLP or not.
So the gallbladder issues and the pancreatitis, does that tend to happen more if you have really rapid weight loss?
Mm-hmm.
Okay. And if you are microdosing versus doing these big doses, is the weight loss slower?
Much.
Okay.
We don't want people losing a lot of weight quickly. Like we reel that in so fast if that's happening. Like it's just not physiologically healthy. And if our goal is to make these people healthier, create a health span, longevity, long-term success, we don't want them losing 8 pounds in 2 weeks.
Right.
Yeah.
Let's say there's two people. There's someone who needs to lose like 50 pounds and then there's someone who wants to lose like 10 pounds.
Mm-hmm.
What is, and maybe this is for the same for both types of people, what is it like, how much weight do you expect them to lose or do you want to see them losing over what time period?
Yeah. So we would not really want people to lose outside of the initial weight loss that's inflammatory. So inflammation drops within 48 hours on these meds, and there's a lot of water weight that's lost during that initial inflammatory reduction. So it's great for people. They get a little excited, but they're not going to continue to lose weight at that level. We really don't want people losing more than 2 pounds a week.
Okay.
A stall for us by definition is less than a half a pound per week for 3 weeks in a row. Anything above that, you're doing great.
Okay.
I mean, up to 2 pounds, right? We don't want people losing more than that.
Yeah. Okay.
And if they do, we reduce their dose. And then I want to circle back to, because such an important point of discussion is this demonization of these meds because of thyroid cancer. Okay. And obviously this is my thing, right? Like thyroid is my thing. So I really dug into the research, really took a lot of care with our patients. I made them get an ultrasound every 3 months for the first 2 years of our program, these poor people, just to see, are you developing nodules? Are these nodules growing? Is there actually a thyroid cancer that we need to be concerned about? Not one time did I ever have an issue, full stop, period. But it's so fascinating that the media is fixated on this idea of thyroid cancer, right? When it has never translated to human studies. So there is no studies supporting this concept of GLP1s promoting thyroid cancer. It happened in rats, which were given anywhere from 20 to 100 times the human dose. And they have incredibly dense amounts of GLP receptors on their thyroid, way more than humans. So because in studies in rats that showed up, the FDA carried the black box warning for specifically medullary thyroid cancer. Even though it's not demonstrated in human studies, even though human studies have shown your chance of developing any kind of thyroid cancer, but specifically medullary thyroid cancer, is less than 1% risk, which is less than the risk that insulin creates for an increase in thyroid cancer risk, which insulin does not carry any kind of warning at all whatsoever for a thyroid cancer. Right. So it's so fascinating because people are being denied these meds because they have, a history 20 years ago of another form of thyroid cancer that's not medullary thyroid cancer. They're post-thyroidectomy. Their mom had another form of thyroid cancer. These are not contraindications to these meds. I have people come to us all the time that tell me their physician or clinician told them Hashimoto's is a contraindication to these medications. Wildly untrue. Hypothyroidism is a contraindication. Wildly untrue. In fact, didn't know this 3 years ago, but all day, every day, I'm seeing GLPs reduce Hashimoto's severity. They literally are reversing autoimmune disease and have since been studied for that in multiple facets and will be a future treatment of autoimmune disease for sure. So it's just, I feel like people are committed to this idea of demonizing these meds when in fact they have so much promise to improve long-term health outcomes.
Why do you think this demonization is happening? Do you think it's because it seems like it's a too good to be true sort of thing? Or does it feel like a shortcut to people?
Right.
What is the reason why it's being so demonized? Because I see a lot of, I see that too. And I just want to understand. Like, I'm like, I'm not a doctor. Like, I just want to see like what it, like, because I feel like people are either so for it or so against it.
Right. I do think that there is this in the general community, right, of just lay people. There's this resentment for the shortcut feeling of people are just doing this. They're not working. They're taking the easy way out. And in fact, sure, like that's true for some people. There is a lot of people that are doing way more than the people pointing fingers that cannot influence things in their health outcomes the way that they should with the amount of effort they're putting in. So I think it's that. But what really fascinated me is this perpetual media cycle about negative dialogue around these meds. And that's where I could not figure out for the life of me, where is this rhetoric coming from? Because there is so much data that shows these meds, they will forever change medicine. Medicine will never be the same. This is the biggest thing that will happen in medicine in my lifetime, for sure.
They're comparing it to like antibiotics.
Exactly. They are our generation's discovery of antibiotics.
It's wild.
It's wild. It will change everything and not just about weight, completely independent of weight loss. And that's what I think people don't understand is these meds have so many uses that have nothing to do with weight loss. Yeah. And the only thing that I could come up with is it insurance companies? Like, are they putting all this bad information out there so they don't have to pay for it? It's expensive for them to pay for these meds. 50% of our country qualifies and are eligible to receive these, and it would destroy profits for insurance companies, I think, in a very significant way because it's $20,000 per person per year forever that these people would be on these meds. That's the only idea that I can come up with because I am thoroughly confused about the dialogue that's been happening over the last 3 years.
Yeah. And then the misinformation or
totally.
Just spreads from there. And,
right.
And then you hear something on a podcast or whatever, and then that forms your opinion and public's opinion. So I could see how it would spiral into that.
Right.
What about for, maybe you don't work with this population as much, or maybe you do. What about for women going through perimenopause? Mm-hmm. Because this is a population that we hear from a lot that really struggles with their weight gain and hormonal health and things like that. So do you see any indication for that crowd?
Yeah. So I have a very liberal viewpoint of these meds in the form that I view them as longevity giving, as health healing. And so there is a huge breakdown of our metabolic function in peri and menopause. And these women are sort of left out in the cold. No one's really investing in them, especially in the perimenopause community. And as we lose estrogen, as our estrogen, briefly increases during perimenopause, this could change everything for those women. Like, instead of promoting heart disease and prediabetes and diabetes, we could literally halt all of that for the foreseeable future for these women if we took them through that phase a little more delicately, a little more intentionally. And I think these meds are a extremely powerful tool to be able to do that.
Mm-hmm. So for someone that's listening and that is going through perimenopause or is like, it's right around the corner, when would they have a conversation with their doctor? Like, what symptoms, or really not even perimenopause, really just anyone. Yeah. What symptoms are you having in which you start to have that conversation with your doctor? Like, is this appropriate for me?
Yeah, that's such a good question. I would say when you're starting to deposit weight around your midsection, which is classic perimenopause, menopause, and that is visceral fat. It is extremely tied to poor long-term health outcomes. And it's harder to lose that visceral fat with diet and exercise Whereas on GLPs, it starts pulling from your visceral fat, the fat that's attached to your organs that increases cardiovascular risk, diabetes, heart disease. It pulls from that first, strangely. So it starts removing that fat very early on in the process. So I would say that's a big one. And then also for me, it is when you are living a good lifestyle and it's 80-20 and you are not able to influence your weight any longer, it's time to have a conversation. When the input of your effort no longer yields the outcome that it should, it's time to have a conversation with someone.
Okay. Like it feels like there's a lot of friction and you're not seeing any
result, or you're doing great exercise regimen, great diet, and you're gaining weight.
We talked a lot about weight loss, and you mentioned a little bit of some of the other benefits. And autoimmune being one of them. Yeah. What are some use cases that you see really good benefits for? Like I think last time I was with you, you mentioned they're seeing positive benefits in Alzheimer's patients.
In Alzheimer's specifically, if you do an MRI before and after a GLP, there is a 13% reduction in the progression of Alzheimer's on MRI over, I believe it was 6 months, but I could be wrong on the timeline. 13% reduction.
Wow.
That's crazy. That might be better than the drugs that we have accessible to treat Alzheimer's specifically.
Yeah.
It can help protect your brain from neurodegenerative changes, reduce your risk for Alzheimer's, reduce your risk for dementia. Autoimmune diseases, it's been studied for MS, which again is autoimmune, but also a neuro issue, potent effects on our neurology, like on our neurological system. And another autoimmune disease that's been studied for is psoriatic arthritis. Yeah.
My husband.
Really?
Arthritis. He's on these like really intense
immunosuppressants?
Yes, immunosuppressants. Right. And I've never, again, not a medical doctor. This is just my feeling.
Right.
I'm like, I just don't love that you're on these really intense medications.
Right.
Like your whole, and just forever.
Forever, right? There's no end in sight. Yeah, I have a patient who's been a patient of mine for over a decade now, and she has psoriatic arthritis, and I've seen her try innumerable things. This woman is just committed to trying to heal her health. I put her on a GLP early on in our program, and then a study came out about psoriatic arthritis, and I immediately reached out to her. And I'm like, tell me about your flares, because we had done all the things. She hadn't had a single one in a year since she had started a GLP.
Wow. Was she combining it with her other like Humira or whatever other medication?
She had been on every immunosuppressant drug and was still having recurrences and issues. Yeah. For years and years and years.
So then with someone like that or someone with an autoimmune condition, is this a drug that they're on for the long term, or is this like one of those things that you're like, okay, you're probably going to have to microdose this forever.
Right.
Or is it something that like you can come off of eventually?
Yeah. So I'll tell you, the one subset of people in our practice that stays on these meds are people who deal with a lot of inflammation. And autoimmune disease is basically a manifestation of inflammation, right? And some people, and these people usually know who they are inflamed. I'm one of those people. That's why I'm fascinated by these drugs and the inflammatory response. Those people often need a microdose. And I mean, I have had patients who reduce and reverse their Hashimoto's completely in remission. They come off successfully and they've been able to maintain that. But there's a lot of people where they come off and their inflammation returns. I have found 4 pathways that these drugs influence inflammation in our physiology completely. Again, what I want to stress is this is independent of weight loss. So many people want to, say back, well, no, they're just less inflamed because they lost weight. No, this happens in 48 hours. Like, I have measured someone's CRP, which is an inflammatory marker, but it also is a cardiac risk marker. It tells us someone's future likelihood of having a heart attack and a stroke. And we sort of break it up into low risk, average, elevated. Anything above 3 is elevated. The higher that number is, the worse you are, right? I measured a patient's CRP before she started our program, and it was 9.6. She did 1 injection. and measured her CRP 1 week later, and it was 4.
Wow.
1 week. And that's what people report all the time is after their first injection, their joint pain goes away. Their puffiness that they've been walking around with goes away. Their achiness goes away. Their brain fog goes away. And that's just nothing to do with weight loss. We're 1 injection in. These people haven't lost a pound, right?
Yeah.
And it transforms their health.
So I think about, my mind also goes in this conversation to fertility, because I know fertility issues, a lot of times there are autoimmune conditions or PCOS or it's whatever. So are there any indications for that group, or have you seen anything with that?
Absolutely. So this whole concept of Ozempic babies, okay? So
what's
I'm
that?
not
I've
sure
never heard of that.
There's this flood of people getting pregnant on a GLP, generally referred to as Ozempic, unplanned, who haven't been able to get pregnant before. And you're not supposed to get pregnant on these meds. Like, you're supposed to wait. Women are supposed to wait 60 days after they discontinue to try to get pregnant. Strangely, men are supposed to wait 90 days after they discontinue to try to get their partner pregnant. But what it's doing, and I wish I had this information handy because I broke down a lot of the studies about a month or so ago. It improves egg quality. It improves egg quantity. It improves the cycling of your hormones and the release of your eggs. And it reduces PCOS and improves chances of getting pregnant and maintaining pregnancy successfully. I found, I think, 4 to 6 studies looking at all of those things. Should be everyone with PCOS almost should be considering and talking to their doctor about these medications, especially if they are wanting to get pregnant.
Yeah, that's crazy.
Crazy.
Because I know, I mean, IVF is obviously a great route for people to take, but it's hard.
Oh, it is.
And
so hard.
Our employee Peyton has been going through it. She's very open about it. Otherwise, I wouldn't see her on the podcast. But
it's so intense.
So it's and I've just watched her go through, and I'm like, wow, it is a lot. Yeah. So that's fascinating. Long-term benefits. Your long-term, we talked a lot about the long-term benefits. Long-term side effects. I know you mentioned the risk of cancer. You kind of debunked that. Are there any true long-term side effects?
I do. I want to circle back to the cancer thing really quick.
Okay.
Because these drugs are now, so everyone's so afraid that they're causing cancer, right? But I want to read off some stats from research about cancer risk on these drugs. Okay. And these are what I have my handy notes for. Esophageal cancer, which is a horrible kind of cancer, reduced by 40%. Colorectal cancer risk, 46%. Reduction. Pancreatic cancer risk reduction, 59%. Liver cancer risk, 53%. Gallbladder cancer risk, 65%. Ovarian cancer risk, 48%. Endometrial cancer, 26%. Wow. So we're all over here being worried about cancer risk with these medications when study after study after study after study is coming out showing that they're protective against cancer. And the other side of that coin that I think is not focused on enough, for whatever reason, our society, we are terrified of cancer, rightfully so. It's a very scary thing. What kills most all of us is heart disease. Heart disease kills more people every year than all cancer combined. And we are somehow not really afraid of heart disease. We're just not super concerned about it. It is the number 1 cause of death worldwide for men and women. Your chance of dying from a heart attack or a stroke or having a heart attack or a stroke on a GLP is reduced, depending on the study, usually around 20 to 30%. Your risk of dying of a heart attack or a stroke after you've already had one, after you've had a stroke, is reduced by 74 to 85% on a GLP. Yeah. You could almost, give us 2 years, you could pick one scary thing to die from. And I can almost promise you there will be studies that show you are less likely to have that event and die from that event on a GLP. So those are the benefits that I think are just not really discussed very much, Yeah. I would say long-term risk. Gosh.
Yeah, because I'm kind of like, what's the catch? You know what I mean? Like, what's the catch?
And I mean, so if this was 15 years ago, I'd be like, let's wait and see, right? Like, we don't know yet. These are not new drugs. Like, this idea of, oh my gosh, like, just wait for 20 years and all these people are going to have all these issues. we're 20 years in already. Like, we already know the long-term outcomes for these people. Nothing is showing up yet. When we do medical studies, I tell you what we don't do is look 20 years out before we approve a drug. So all of these drugs that people are taking flagrantly, without opposition, not worried about anything, we don't have studies 20 years in for those drugs that say they're safe.
Yeah.
We'll figure out in 10 or 20 years if they're not. But we do have a lot of data on GLPs. And personally, I think people are going to live a much longer, healthier life if they choose to be on them. I think their lifespan and their health span will be improved. Everything is pros and cons, and everything needs to be done in a little more of an individualized basis. But medicine is all about risk versus benefit. I've never seen, again, a class of medication where the risk profile is so low and the benefits are so large.
So if someone's like, okay, I'm interested in seeing if this is a good fit for me, do they go to their primary? Who do they go to have this conversation?
So my perspective is skewed. Like, I do not believe that people should be taking, or a lot of people should be taking, the standardized dose of these medications. And I also believe that people need to be in the care of someone who's willing to individualize treatment. And that at this point is still really hard to access. So I would say you want to find someone that's a little bit more progressive, right? Maybe a functional medicine person. This is the whole reason we're starting Modern Weight Loss nationwide, so that people can have access to tailored, individualized care with these meds and not be put into this one-size-fits-all mechanism that doesn't serve a lot of people. So you want to just be attuned to that. You want to find someone who uses more of a progressive, individualized approach.
So maybe that's kind of the catch, is that it's not a one size fits all. And so maybe it's getting overdosed for some people and causing these issues, and hard to find a practitioner who can dose it appropriately and like think about you holistically.
Totally. And I think we're not there yet. I do think we'll get there. I really do. I think we're making the moves to make this more accessible in those methods. But you're right. That is the catch. And the alternative, right, when you are on too much, is people don't feel well. It is muscle loss. It is all of these things that don't have to be the case, but they sort of still are in a lot of individuals.
Yeah. Have you ever taken it?
Yeah. Great question. So I absolutely did. I try to try almost anything before I offer it to my patients. I sort of have that as my motto. I also do not ever ask my patients to do anything that I have not already done and am not willing to do myself. So I absolutely did. In fact, I would microdose for quite some time until about 8 months ago. I had to stop. We had some stressors with my daughter's health and I just wasn't eating enough food. So I had to pull back. I cannot wait to restart it because for me, it is life-changing for my inflammation. Absolutely and I do a lot for my inflammation. I do all the things. My whole job is to help people with this, but there's nothing, no lifestyle intervention, no medication, nothing that I've ever found that holds a candle to the inflammatory reduction that a GLP elicits.
Tell me specifically the symptoms that you experience.
I think inflammation is individualized. Like people can, experience it in different ways. My experience is a lot of brain fog. It's fatigue. It's malaise. It's feeling like prodromally sick, like you're just about to get sick, very puffy. If I get inflamed, I can hold on to 15 pounds of water weight overnight, easy, nothing.
Wow.
Yes, absolutely. Other people get it in the form of joint pain, bloating, distension, food reactivity. Like people's reactions to food massively diminish on these meds. Like they just don't react every time they eat. So it is individualized, but that is my experience. And it's been my experience as long as I can remember from childhood. So being able to influence that in a powerful way is life-changing.
Yeah, absolutely. Yeah. Any other myths that you did not touch on? You touched on a lot of them. Or any last parting words that you want to leave the listener?
My hope for the next era of these meds is that women don't feel like judged and ashamed about it. I do not view them as the easy way out. I do not view them as, for lazy people who don't want to put in the work. And I would challenge people who have that perspective and who have the perspective that weight loss is as simple as calories in versus calories out. For some people, it absolutely can be. What I want people to know is there is a huge, huge percentage of the population, especially among women, where their metabolism does not function the same as someone who has good metabolic function. Their metabolism is damaged, whether it's from hormones. Hormonal shifts influence that, whether it's from thyroid, whether it's from any number of things. The answer for one person is not the answer for other people. And there are a lot of people who are putting in the work every day that cannot get the outcome that they deserve. And this is an answer for that, for those people. And it's not lazy, and they shouldn't be judged. They should be supported.
Yeah, because I think that's how it is right now. Like it's very hush hush if somebody's on it.
Yeah.
Like or like, people are gossiping like, oh, so-and-so is on Ozempic, so-and-so is, taking Wegovy. And so I think there's very much a stigma around it right now. So it'll be interesting to see as people are educating about this drug more, how the narrative changes. And I think narratives around things like this can change really quickly.
Yeah.
So it'll be really interesting to see what changes over the next few years.
It will. And I mean, I think, my call to action for so many of my colleagues in this world of progressive medicine that have been speaking negatively about these drugs for the last couple of years, I'm like, you guys can't keep doing this for long. This has to end. There's too much data that shows the benefits of these meds and how powerful they can influence someone's health. We don't need to be talking about muscle loss when that's completely avoidable. People build muscle all day, every day on these meds.
I think when when I first learned about this, I felt the way the majority of the public feels. I was like, oh, this is, what's the catch kind of thing. And then I started asking myself questions when I heard Gabrielle Lyon. Do you know Gabrielle Lyon?
I know her. I've known her for a very long time.
Oh, cool. Yeah. Anyways, she's very big proponent on muscle.
Yeah.
And I heard her. And so I thought, okay, she's not going to be an advocate of these drugs.
She is.
I thought it causes muscle loss. And that's why I was like concerned about them at first. Cause I was like, people are going to lose muscle, and I'm very pro muscle.
Right.
And then I heard her talking about it, and she was like, no, we don't see that happening when we're dosing it appropriately and they're strength training and eating enough protein. We're not seeing that.
People are building muscle. It's impossible to deny. I have to see it every day.
Yeah. And so she's an advocate of it. And I was like, oh. And so that's when I was like, there are lots of doctors and practitioners who are kind of who maybe once, I don't know where she stood on it, but like maybe once were kind of like bashing these drugs and now are coming around to them. So I just think it's so fascinating.
I'm so happy that you kept an open mind and kept asking yourself questions. I think it's so easy as humans to like commit to your viewpoint and stand by it and not challenge it. But
you have to.
It says a lot about you to be able to do that, because that's a very powerful tool that will influence your life, but also it helps so many other people.
Well, I think also I need to stay in my lane. I'm not a medical doctor. I'm not a PA. I'm not someone who would ever prescribe a medication. So I need to stay in my lane and just get curious and learn. So that's always my goal. But I think this was extremely fascinating. If someone wants to work with you, tell us about Modern Thyroid and Modern Weight Loss.
Yeah. So right now, Modern Thyroid is in about 30 states. We'll be in 50 in the first quarter of 2025. So grateful. We take a very progressive approach to thyroid hormone treatment and largely are based around supporting women. And then we are launching our sister company, Modern Weight Loss, so soon, like in weeks from now, and it will be nationwide. And I'm grateful and honored to be able to offer the program that we've built and cultivated and refined at Modern Thyroid Clinic to the nation. And I just think it's going to change so many lives. So
awesome.
You can find us at modernthyroidclinic.com or modernweightloss.com.
When would someone go to Modern Thyroid versus Modern Weight Loss? Like what symptoms would indicate each business?
So, Modern Weight Loss is simply GLP-based program tailored to you, a lot of support. This is not a system where we send you a prescription and are like, bye, good luck. No, we have weekly calls. You have tons of support. And so that is really just the metabolic piece, the longevity piece. Modern Thyroid Clinic is really an all-encompassing, not just weight loss. We deal with optimizing thyroid. We can treat even the most complex of thyroid disorders successfully. Our success rate is absolutely unparalleled. We also deal with any and absolutely all hormone dysfunction in women and men. So if you have both of those, one of those, and you're struggling with weight as well, we have an in-house weight loss program that we replicated for modern weight loss. So you can get everything under one roof as well. But that's just more an intensive support.
Yeah. I was a patient. I am a patient of Modern Thyroid, because our last conversation we had, you were like, I think maybe you should come see us. Like, because I've always had like all this fatigue and stuff like that. And so I've had an appointment. It was like an hour long, extremely thorough call. Yeah. They look, I mean, the NP, NP that I worked with was awesome. The communication is awesome. So again, I get no kickback from this, y'all. I'm just like, I just genuinely had such a good experience. So if you are questioning it all, go talk to them and see if you're a good fit. But
we pride ourselves in our care for our patients, and like all of our clinicians have a thyroid condition. Their lives have been touched by this. They have a high amount of empathy, and we just have the best darn team. So thanks for spreading the word.
It's awesome. Instagram, TikTok, website, well, Modern Thyroid and Modern Weight Loss, Instagram and TikTok.
Love TikTok, love Instagram, McCall McPherson on both, or Modern Thyroid on both. Actually, Instagram's McCall McPherson PA. And then we also have a podcast that you're going to be a guest on, Modern Thyroid and Wellness. So you can tune in to us there as well and go a little bit deeper.
Yeah, we're about to record for your podcast. So listeners will have to go listen to that.
Yep.
Thank you, McCall.
Yes, absolutely. Thanks for having me.
Yeah, it was awesome. All right, listeners, thank you. We will see you next week. Same time, same place. Bye for now.